Welcome to Medical Misfits, everyone. Today we're diving into the mediastinum, the central compartment of the thoracic cavity. It's a fascinating region packed with vital organs, vessels, and structures that keep us alive and functioning every single day. Imagine the mediastinum as the bustling downtown of your chest. It's where the action happens, a central hub where life-sustaining highways of air, blood, and nutrients converge. Today we're exploring this amazing anatomical region to uncover why it's so vital to your survival. Let's get started. The mediastinum is the central compartment of the thoracic cavity. Think of it as the space in between your lungs, where all the essential structures are packed. I'll outline it for you guys right now. Before we go into further detail regarding the different compartments of the mediastinum, we need to focus on a different anatomical perspective, known as the sagittal view, which in simple terms means from the side. To make the different compartments of the mediastinum easier to understand, I want you guys to picture a house. So we have a downstairs and we have an upstairs. Now downstairs consists of 3 separate rooms. We'll call them room 1, room 2, and room 3. Now upstairs consists of just 1 room. We'll call that room 4. Now the same thing applies to the mediastinum. We have a room 1, a room 2, a room 3, and also we have a room 4 upstairs. Now of course, these compartments are not actually called room 1, 2, 3, and 4. However, the reality is not much harder. Let me explain. Room 1, as you can see, is at the front, so we call that the anterior mediastinum. Room 2 is in the middle, so we will call that the middle mediastinum. Room 3 is at the back, so we'll call that the posterior mediastinum. And room 4 is at the top, so we will call that the superior mediastinum. Now that we've covered the different compartments of the mediastinum, we can talk about the borders and contents of each one. Let's start with the superior mediastinum. The superior mediastinum compartment is bordered anteriorly by the manubrium and posteriorly by the first 4 thoracic vertebrae. I should also mention that the superior border is the thoracic inlet and that the inferior border is the plane of the sternal angle, both which are visible in the illustration. Now none of these compartments are just empty cavities. They all have critical structures that are essential for our survival. So, what are the contents of the superior mediastinum? We first have the aortic arch, which I'll outline for you in this illustration. It also contains the trachea and the esophagus. Now both of these are not very visible on this illustration. However, I will point out that the trachea is located just posteriorly to the heart, approximately in this location, and that the esophagus is located just posteriorly to the trachea. The anterior mediastinum is bordered anteriorly by the sternum and posteriorly by the middle mediastinum, or more specifically, the anterior aspect of the pericardium, which is a thin layer that encloses the heart. Its contents include the thymus, which is more prominent in children as it functions in the development of the immune system growing up. It also contains some lymph nodes and the internal thoracic vessels. The middle mediastinum is bordered anteriorly by the anterior aspect of the pericardium and posteriorly by the posterior aspect of the pericardium. Now I know it looks like a long list of contents, guys, but I promise you it's not that bad. Let's go through it together one by one. So, the first thing is the pericardium and the heart. I mean, it's pretty obvious if you ask me. The next thing on the list is the ascending aorta, which I can actually outline for you guys on the illustration. The next thing on the list is the superior and inferior vena cava. I believe the next 2 are also vessels. Yep, the brachiocephalic vessels and the pulmonary vessels. The pulmonary vessels can actually be seen in this illustration as well, which I will outline here. The next thing on the list is the main bronchi, And in this specific illustration, we can outline the left bronchus. And it's the left bronchus because we're looking at this model from the left side. Now the last thing on the list, well, I should say last things, are the phrenic nerve, the vagus nerve, and the left recurrent laryngeal nerve. Now the phrenic nerve provides innervation to the diaphragm. The vagus nerve provides important parasympathetic and motor innervation to structures primarily related to the heart, lungs, esophagus, and nearby regions. And the left recurrent laryngeal nerve is actually a branch of the vagus nerve which travels down, loops around the aortic arch, and travels back up towards the larynx, where it provides motor innervation to all the intrinsic muscles of the larynx except for the cricothyroid muscle. Now we're going to talk about the posterior mediastinum. The anterior border is going to be the middle mediastinum, or more specifically, the posterior aspect of the pericardium. And the posterior border is going to be the thoracic vertebral column. The contents are going to be the esophagus, the azygous and hemiazygous vein, and also the descending aorta, which I can outline for you guys here. That's a wrap for our very first video here on Medical Misfits. I hope this breakdown of the mediastinum gave you some clarity regarding the topic. Since this is my first video, I'd love to hear your feedback. Drop your thoughts in the comment section below. Thank you for watching, and I'll see you in the next one.